We've got to follow the science. If a study that's a good study comes out and shows efficacy and safety for hydroxychloroquine or any other drug that we do, if you do it in the right way, you accept the scientific data. But right now, today, the cumulative scientific data that has been put together and done over a number of different studies has shown no efficacy. So when there's a video out there for a bunch of people spouting something that isn't true, the only recourse you have is to be very, very clear in presenting the scientific data that essentially contradicts that.
With the patience of a saint, Dr. Anthony Fauci pleading again with the American people again to do one simple thing: listen to the science. And it comes in the wake of the president again today touting hydroxychloroquine as a treatment for coronavirus, following yesterday's defense of his promotion of a now deleted video that showed some questionable medical experts, if we can call them that, claiming that the drug was some sort of cure. The coronavirus still sweeping across this country with devastating effect. The death toll passed 150,000 Americans yesterday, and a new federal report shows the government warning 21 states are now in the red zone and need to take aggressive steps to combat the coronavirus. Joining our conversation, Dr. Irwin Redlener, director of the National Center for Disaster Preparedness at Columbia University, and an MSNBC public health analyst, Yamiche, who gets to pose a lot of these questions to the president herself, has agreed to stick around. Yamiche, I've got to start with you and what is just bizarro world. And you're not someone who fell for the idea that the White House had successfully carried out any sort of conversion of who the president is or what the president does. But there were people who were who noted that he seemed to stay on script for a few minutes last week at those now revived coronavirus briefings. But he's back to touting dangerous disinformation about a drug that has been warned to be dangerous and seeming to be rowing against the work that Dr. Fauci is trying to do.
That's right. And I think I continue to think about the expert who said, if you mix science with politics, what you get is politics. And President Trump has been really, really eager to try to put the coronavirus in the rearview mirror. He's been, at one point, he was reading off of notes saying, yes, it's going to get worse before it's going to get better. But even after he read off those notes in the same briefing, he said, look, at some point it's going to disappear, of course, without having any evidence. The president is eager to try to find a way to say, I have solved this issue. Let's all move forward, when he knows that Americans are laser focused on this, and that people who took his advice, including the governor of Florida, my home state, Florida is now in some ways a hot spot. And there's a state suffering because a governor decided to take the advice of President Trump instead of listening to scientists like Dr. Fauci. So Dr. Fauci today is out saying, don't take hydroxychloroquine unless you're there with a doctor. And the president is in, and Peter Navarro, I should add, his trade advisor, who of course is not a scientist, has been out saying that these drugs could be helpful and that they're somehow being stymied by other people, other forces. So it makes it is very confusing and it's very alarming this is happening. But what we do know is that Dr. Fauci is someone who Americans trust. Poll after poll show that. And it's also true that Dr. Fauci is saying the best way to continue to do this is the way that he's been saying to do it and since March, and that is washing your hands, keeping your distance. So the president, I think, is a little frustrated. We heard him this week say, why does Dr. Fauci have so many high approval ratings? Why don't people like me? So as you can tell, that the president is also focused on his own approval ratings in this moment, and people just simply don't trust him in a large part on this when it comes to the virus.
All right, I wasn't going to play it, but Yamiche just teased the woe is me sound. So Dr. Redlener, let's watch it and talk about it on the other side.
We could have gotten somebody else. It didn't have to be Dr. Fauci. He's working with our administration. And for the most part, we've done pretty much what he and others, Dr. Birx and others who are terrific, recommended. And he's got this high approval rating. So why don't I have a high approval rating with respect, and the administration with respect to the virus? They're highly thought of, but nobody likes me. It can only be my personality, that's all.
As the mother of an 8-year-old, this is conduct reprehensible in small children, and it is so unbecoming of our country's leader. I don't even know what to say about it. brain around the fact that Fauci has public support because Fauci is viewed as being motivated by the public good is the piece that I feel endangers all of us.
Yeah, Nicolle, it's just incomprehensible. The self-pitying on the part of the president is absolutely pathetic, and a side of him which we really haven't quite seen before. But what we're dealing with, if you combine that with his statements on the hydroxychloroquine, we either have a case of really incurable madness or some sort of intentional manipulation of public opinion around some absolutely dishonest statements about the effect of hydroxychloroquine, added to the pantheon of untrue statements that the president's made for, since the beginning of all this. I can only imagine that there may be some sort of twisted logic in trying to create some image that will help him in November for his reelection. I just don't see how that all works, and he's looking increasingly unstable. And the promotion of this pitiful, recurrent, imagination about hydroxychloroquine is just one example of many. I don't know how they're going to construct a narrative that's around COVID that's going to help him in November, but I guess they'll keep trying.
Yamiche, Gohmert, who is Congress's version of Donald Trump, Congressman Gohmert tested positive, and he said this, quote, "I can't help but think that if I hadn't been wearing a mask so much in the last 10 days, I really wonder if I would have gotten it. But I know, moving the mask around, getting it to sit just right, I'm bound to have put some virus on the mask," end quote. I don't even know what my question is, but I guess with friends like this, it's no wonder the Republican fortunes in the fall look bleak at this point. Is the White House trying to at least get some of the president's allies on a less sort of mask skeptic message?
I think it's going to take some time because the president was so slow to adopt and embrace masks. Now, it should be noted that Dr. Fauci at the beginning was saying that masks were not needed. But then he said, look, we were saying that because health professionals needed them and we were worried that there was going to be a shortage. He has since changed his position. But President Trump took months and months and months to then adopt that position. I think this Congressman Gohmert, it's hard to wrap your brain around what's going through his head, especially when you think about the fact that he learned he was positive because he was trying to get on a plane with President Trump. So it begs the question of why he's so skeptical when he now knows that he was carrying the virus asymptomatic, walking around the Hill. Yesterday in the House Judiciary hearing, Chairman Nadler literally scolded Republicans for not wearing their masks during the hearing, and they kind of rebuffed him, and conservative media kind of attacked Nadler for that. It's questionable why in America, and especially among the Republican Party, why there is a big political debate. It's become almost tribal whether you wear a mask or where you don't. But President Trump, in some ways, is at the heart of this because he only joined Team Mask a few weeks ago when the majority of industrialized, developed nations have been on Team Mask since like April.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.